I do think that's the case. The AstraZeneca vaccine is cheaper. It doesn't have very onerous storage requirements. So this may be the vaccine that the world uses. It is a two-dose vaccine, and eventually that might get replaced by a single-dose vaccine. But of the three leading contenders, this is the one that's really more scalable to the developing world.
So essentially what you're saying is that we could get two tracks of vaccine, one for the developed world, which is essentially Pfizer and BioNTech and the logistics surrounding storing it at minus 70 degrees Celsius, and one for the developing world, which is just cheaper and easier to transport.
Yes, I think that's likely to be the case. And it's not that one vaccine is better or worse than the other. It's about how you actually distribute the vaccine and turn it into a vaccination. So I think that all of these candidates are really exciting, very good data. The AstraZeneca vaccine is showing even that it prevents asymptomatic infection, which is data that we don't have for the Moderna and the Pfizer versions. So I think this is just going to be a situation where we're looking at what can a country deliver in terms of the vaccine, in terms of cold storage, and then you kind of make a decision based upon that. And I think that it does look like the AstraZeneca vaccine may be the world's vaccine, while other vaccines may be used in other parts of the world where they can do the cold storage, where they don't have these same issues.
Amesh, what are the chances of AstraZeneca getting that FDA approval?
I think there is a good chance that they will get an FDA approval, but I suspect that they will get an approval in the United Kingdom and the European Union first, and I think that's their strategy. And then they will be applying for FDA approval. I think they're still waiting for some of their trial data in the United States, but they will take that data from the US coupled with some of the international data and then likely submit. And the more vaccines we have for the world, the better it is.
Can you talk to us about the differences between the AstraZeneca and the Pfizer-BioNTech and Moderna? Because the two of them uses RNA technology, whereas the AstraZeneca one actually uses a modified version of a chimpanzee cold virus.
So all three of these vaccines are using what are called vaccine platform technologies. These are technologies that didn't exist a decade ago. While Moderna and Pfizer are using an mRNA platform, which is basically just taking the gene of interest, the spike protein from the virus, and basically giving your body that formula to make that protein and allowing your cells to pump out that protein, which then your immune system reacts to. The AstraZeneca vaccine takes that protein and basically engineers it into a chimp adenovirus. Adenoviruses are common cold-causing viruses. So this is another type of platform where they're using the virus as the delivery mechanism for the gene of interest. And then that chimp adenovirus infects your cells, and it makes the spike protein, which your immune system reacts to. Really great examples of technologies that have advanced rapidly over the last decade or so, and that's why we've been able to make these vaccines so fast compared to what has happened traditionally. Two different things, but I think they're both important pathways to get vaccines, and will likely change the field of infectious disease forever, because this will be the go-to way of making vaccines anytime we have an emerging infectious disease outbreak in the future.